Today, we're going to talk about relaxation methods that are useful for those with the human immunodeficiency virus, or HIV, and the acquired immune deficiency syndrome, or AIDS. Many people that suffer from HIV and AIDS are impacted by the numerous amounts of medications that they are required to take in order to increase their immune status. One way for our patients to not be so burdened by multiple medications is to use some complementary or alternative methods to increase their immune status. Stress is a common finding in those that have HIV and AIDS and can also decrease the immune status of these patients. Finding ways to help patients cope with stress is important for those affected by the disease. Our topic for today that we're going to focus on is Tai Chi. First off, we'll have Rhonda explain a little bit about HIV and AIDS.
Thanks, Grant. According to the Fort Wayne AIDS Task Force, HIV attacks the body through communicable fluids such as blood, vaginal secretions, breast milk, and cerebrospinal fluid. HIV attacks the T cells within the body, replicating the viral DNA within the cell. Once it is replicated, it kills the T cells, moving on to other T cells to replicate within and destroy. As the number of T cells within the body decreases, the patient becomes more susceptible to opportunistic infections. HIV doesn't kill the patient, it only decreases the patient's immunity. There are 19 opportunistic infections a patient with HIV or AIDS can acquire. There are certain antiretroviral agents that can help decrease the replication of the virus. It is only when there is an undetectable viral load that the virus has stopped replicating. This is the goal for those with HIV in order to not allow their disease to turn into AIDS. Those that suffer with HIV and AIDS are 2 to 3 times more prone to anxiety, depressive symptoms, and panic disorders as compared to those without HIV and AIDS. This concludes that those with HIV and AIDS would require additional medication in order to control these new symptoms in addition to their antiretroviral medication. Finding a non-medicinal way for these patients to reduce symptoms of stress and anxiety would be beneficial not only for the patient's immune status, but to decrease the possible adverse effects of drug interactions. There has been a variety of methods used for coping, including relaxation, meditation, and exercise. Today we would like to focus on one of these methods, Tai Chi.
This is a form of martial arts developed in the 12th century. It's generally practiced without weapons and is composed of slow, rhythmic movements which flow together. Although it was originally developed for the purpose of self-defense, people began to use it for health purposes. It is a low-impact type of exercise that is a more appropriate alternative for those who are unable to perform more active programs. There has been a variety of research determining the health benefits of Tai Chi. These have found improvements on cardiovascular, respiratory, and musculoskeletal functioning. Also, this practice improves posture and balance control, decreasing pain and stiffness. According to a randomized clinical trial conducted by Robbins et al., Tai Chi was beneficial to HIV and AIDS patients, showing statistically significant improvements in their psychosocial functioning, quality of life, and immune function. Galatino et al. Discussed that the main mortality risk factor for those with HIV is a decrease in lean muscle tissue. By doing aerobic exercise such as Tai Chi, can reverse weight loss and increase lean body mass in those with HIV.
Of course it is important for patients to talk with their healthcare provider prior to starting any alternative form of therapy. Although Tai Chi is a safe alternative exercise regimen for most patients affected by HIV and AIDS, it is not acceptable for those that are pregnant, have hernia, or joint problems.
We would like to thank you for allowing us to share some information about relaxation and the benefits of Tai Chi. We hope you utilize this information in your practice when dealing with patients with HIV and AIDS.
Here we're going to show you a few examples of Tai Chi.